My name is Julian Gordon. I'm with Rise Healthcare Partners, and I represent several products. But here I'm going to talk about some dressings through HydroWare. Before I start too, I'm not a clinician, but I did stay at a Holiday Inn last night. But I have about 25 years of wound care experience, so we're going to try to get through this and just tell you some things of experience that I have through my career. Guys, when we look at this, 60% of most patients need dressings for over 6 months, and 40% of those patients use some type of home remedies. That's sanitary napkins, adult diapers, kitchen paper towels, rags. We've heard all the stories, and I'm sure you guys have been through all the experiences. The real issue is we really need to get a lot of the patients into, these dressings, these adhesive dressings, the non-adhesive dressings, and the bandages that are medical grade dressings that you can really use that are covered by insurances. And another thing, a lot of these dressings are difficult to dress areas. You have joint movement, you have body hair, you have heat and moisture, body curves, skin folds, and delicate skin. These all can cause different issues when dealing with wound care and dressing your wounds. Challenges with everyday dressing wound care. You got adhesive dressings that pinch and peel the skin. We see a picture up here where you see the effects of using that adhesive dressings. The bulkiness of using paper towels and things, and just the awkwardness of it. The staining, and again, using the netting. These are all bulky and discreet, and inevitable they lead to leaks in you guys' dressing. Why is it effective for wound care? So simple. It reduces pain and prevents infection, and it manages draining wounds and speeds up healing. And I want to touch a little bit on those two as we go into it. But it also improves quality of life and protects your skin. When I want to talk about the managing the drainage and odor, we're going to talk about that in a couple of slides because it's very important when you're talking about managing that drainage when you're in wound care. You got medical-related skin adhesive, so redness, inflammation, skin. This can strip the skin. You got the blood blisters and pain. This is caused by those irritation of skins. I know in way of a lesser leg, I get this when I wear Band-Aids. Every time I wear a Band-Aid, I can't even go to the doctor, wear Band-Aids anymore because I get some of that irritation. That happens a lot in a lot of different dressings that you guys will use. Moisture-associated skin damage. This is what I want to talk about. We talked about this maceration. Guys, a wound is a very delicate dance if you want to look at it. You don't want it to be dry and look at it like a desert because then you're going to look at scarring, you're going to look at scarring, and that wound's going to stall. All right, but you don't want it too moist because then you're going to talk about maceration and all those things that are peri-wound around the wounds, which is going to cause those further breakdown. So you want that fine balance between moisture and that dryness because you don't want it too heavy, but you don't want it too dry either. So a lot of these dressings are your professional wound care professional will be able to tell you exactly what to do and manage that, but you want to really think about that when you're draining a lot in your wounds. Different types of dressing, super absorbents. Through insurance coverage, you're going to be able to get at least one a day these days, every dressing change. So a super absorbent is a 30-day, everyday dressing change. You have your foam adhesive. That's an every other day dressing change. So you could do that every other day. You could change those dressings. And then your antimicrobial dressings, you're going to find this in a lot of different dressings that you got out there. And that's just a dressing that has those antimicrobial properties in there. You call those a lot of impregnated gauzes and different applications. And then just your standard island dressings. And they're for the low, moderate, exudate, and proven to provide absorbent fluid. Keeping dressings in place. Obviously, this is a challenge for everyone here. It's not only just a challenge in HS patients, but a challenge in also difficult to dress wounds. You have your film. These are also breathable. They're very thin. These are also covered by insurance, but you can use these to get on there. There's several different brands out there, but it goes over the wound and it can keep your wound in place. And then you have your bandages, your elastic material, your adhesive tapes, and then your netting. These are all different forms of how you can fasten your dressings and keep them in place, but are they practical and do they really help you guys, have your quality of life? HydroWare. So this is one of the products that I do represent. This is a great product, and I think it's a life-changing product when you're dealing with these things. As you can see, this is a tapeless dressing system, as we call that. This comes with a base layer along with the dressings that go along with it, so it comes with the dressing. So it's a tapeless system. You're not gonna have to worry about, is this gonna fall off? Am I gonna sweat too much? Or am I gonna drain too much where the dressing's gonna move around? It locks in place, and the patent technology with the Sure-Lock tabs really keeps those dressings in place to really absorb that moisture. Wound hygiene. It's very important to keep your wounds clean, guys. The wound hygiene is very important. I highlighted just the three different of the wound washers that you have. These are all available through insurance, and you can get these. That's as a typo. It does in the VOSH says it's prescription only, but you can get that over the counter, so that's my mistake, and I apologize for that. But you want to gently clean around the lesions, use warm water, clean with soft cloth gauze, and pat dry. Don't rub. But it's really important to keep your wounds clean and managed to really incorporate that healing. Wound care support. Guys, this is one of the next two slides are probably the most important two slides in my opinion that I'm going to talk about. And that's just your wound care support. Being an advocate for yourself and knowing where to go to get your proper wound care management, whether if that's your family care doctor, if that's your dermatologist, if that's your wound care provider at your wound center, whatever it is, getting that wound care and asking them to get involved and getting yourself involved in your treatment. I heard one of the doctors talk earlier today, be part of the team. You are your team. You are part of your team, and it's important that you guys talk to that and be part of that with them. Check and see if your insurance covers it, because most insurances do. But there's nuances that, co-pays and deductibles and things like that. It's so hard to predict because insurance is such a wide range of predictions. Let's put it that way. I'll keep it nice. Where to go for wound care support? I touched on these next two slides. You can go to your family doctor. They can prescribe HydroWare for you with the proper documentation. You can go to any wound center. They can provide HydroWare with the proper documentation, along with your dermatologist. Now, we just listed those individually. In my opinion, all three of these people should be working for you together in one cohesive unit. Okay, it takes a team, and as we always say, it takes a village. It takes a village to heal this, and you should be part of your team as well. Advocate for yourself. Wound care through DME. So through HydroWare, through this product, it's called DME. It's called a durable medical equipment. This is how you're going to get your supplies through HydroWare. A lot of your wound care dressings, even if it's not HydroWare, you're going to get it through a DME, and it's durable medical equipment. How that works is your physician writes a prescription, and they write the order of whatever they need. If it's a silver, if it's HydroWare, whatever that might be, they write that prescription for you. They choose the DME provider that they choose to that send it to. That DME provider then checks your insurance, verifies your coverage, tells you if you have a copay, if a deductible. Usually, they contact you if there's any out-of-pocket pay, usually, but I can't say every customer service operates the same way, and sometimes it is missed, but they do check it. Once they do check it, they send it out to the door, and you get a package delivered onto your doorstep for all your dressing needs. The one thing that is important when you get these, depending on the DME provider, if they will accept a 30-day script or a 90-day script. If they only accept a 30-day script, you will have to continue to go back to have your wounds reassessed every month in order to continue to get those dressings. If that's fair? And then allowables and quantities. I kind of went over this just a little bit. With your super absorbent dressings, you're going to get 30 a month, which is a once-a-day dressing change. Okay? With the foams, you're going to get 12 per month, which is an every other dressing change. And the allowable for the HydroWare base layers a year, you're going to get 2 base layer garments for each infected area. So if you have an infected area up top, an infected area on the bottom, you would get a base layer for the bottom and a base layer for your top. And remember, wound care is important. And like I said, you guys deserve effective wound care. You don't need to, like I said, I get, it's a lot of fear, I think. I'm even talking to patients, and people today, a lot of fear of, oh, I don't know, I'm going to try it. I have a system already. But guys, these are systems that you don't have to rely on the homemade solutions. You can empower and manage it yourself because these are covered through your insurance, if that's the route you need to go. These products are also used, you can use your HSA card to use, you can use all these types to get these things. I always a big advocate for insurance because if you do have it, there's no use of paying out of pocket for that when you can get it covered through the different channels. And again, advocate for yourself and ask the physician to describe this to you. It's so important to advocate for yourself of who you want to be and where you want to be. I myself had a condition that I went to 3 different doctors until I found the right one who made me feel like I was a person. And I think that's important to anyone dealing with anything, okay? But guys, I know this is a kind of a brief presentation, but I do want to open it up to any questions and answers that you guys have. I've been in DME for 25 years and been in wound care 25 years. I can answer as much as I can possibly try to answer without trying to be too clinical. How's that? Any questions? Yes, yes, sir.
In your experience, do you find that it's an uphill battle getting insurance to approve this kind of stuff?
I would say with the proper documentation, it usually is pretty simple. Usually in the past, there's just little different nuances, and it's just physicians really learning what the documentation needs to get the insurance covered. Whether it's the drainage, if it's the measurement, if it's showing that it's been debrided. Insurance is a fine dance, and you just got to word it the right way, and having reps out there now and having people out there that understand those coverages and things like that, we found it's really starting to help with the process of getting it approved. Great question. Yes, ma'am. Almost like built in, what you're saying? That's a great question, and I can go back and we can have that discussion. But as of right now, I don't know. But it's something I can go back and ask. How's that? Yes, ma'am. There is a cash pay option as well. If you go to Hydromed's website, there is an option to go in there, and you can do a cash option as well. Okay, and it is pretty reasonable too as well when you're looking at some of the different home remedies that you go through as far as going to CVS and gauze and tape and things like that. It's going to be around comparable to that, but with that cash item offer. Okay. So each infected area, okay? So if you have one under your left armpit, one under your right armpit, you would get 30, 30, and then any other affected area, you'd get another 30. Or if it's foam, 12, 12, 12. Okay. Make sense? Yeah. Yes, ma'am.
So it seems like there are only certain areas that the hydroware will cover, or is it just what's represented up here?
Right now, I think those were the most common areas that was first come out and what was said. You know, and that's what HydraWare developed in the R&D and their focus groups and things like that. I think are always looking and listening to feedback is really important to them. So when they get that feedback, they try to use that, and that's how they try to develop other products and other situations for that. So that's kind of what I know. So the feedback is really important. If you are a user of HydraWare and you do have an opportunity to go on there and go to their website and give your feedback, I think that is really important because it helps them stay in front of helping the community out and really stay in focus and letting them, I always say, you can be seen. Yes. We do, and that is Rise Healthcare, and that's the firm we have. So we are located across the country, and that is what we're tasked to do. We've been representing the product since January, so we realize that we've got a lot of work to do still in education, but that is what we are. That is our goal, and that is our mission, and that's our passion.
And nobody has ever mentioned that to me, so thank you for your information, and, I'm hopeful that you all will educate appropriately.
I appreciate it, and I thank you that. Thank you.
I guess to kind of sort of jump on what she just said, what are you guys doing to speak to other physicians, doctors, to make sure that we hold them accountable to actually be giving out this information? Because I think that it's amazing for us to have these conversations, but if we're not doing anything like directly to physicians, like, hey, this thing exists, here's a pamphlet, actually give it out. What are you guys necessarily doing in that respect of keeping other doctors accountable and making sure that they're providing their patients with the type of care or information that they deserve?
Knocking on as many doors as I possibly can. I mean, it's a process. I'm just knocking on doors as much as I can. Believe me, this is become like a passion for me. I've learned about this disease a while ago, but I really, really, truly dug my feet into it since January. Since then, I've learned I have cousins who have it, so it's become like a passion for me. So I'm really, really being an advocate and really trying to spread that word to my team. And hopefully my passion is showing through my team as well to really show that, hey, this is something that's, as I say, it's the most common disease no one talks about, and we just got to start talking about it. Yes, sir. Absolutely. We are in partnerships. We're trying to develop partnerships with all the, I think one of the doctors showed all the different foundations on there. So we're trying to partner with them and really try to see how we can work with them to really try to see what we can do together to really to strengthen this community and really get the word out so we can be advocates for it. And we're not hiring right now. Well, ladies and gentlemen, thank you guys so much for this. I really just enjoyed my time here, and this has been just a great experience, and I'm glad you guys let me have the opportunity to come out here and speak to you today.